founder and physician. I'm here with my head athletic trainer, Julieta Guzman. We're going to show you injury prevention and warm-up techniques for cycling. Here we go.
So we're going to start off the bike first, and you want to do this without your cycling shoes on, okay? Because otherwise it'll be a little too unstable. So we're going to start off with leg swings. So you're going to hold onto your bike, a wall, something nearby, could be a tree, and we're going to start with one leg, just swinging it back and forth. Okay, we want to make sure we're warming up the musculature that you're about to use on your ride. So just getting on your bike and going for a ride is not the warm-up, okay?
How many?
20 swings, then you're going to switch side, and you're going to do 20 swings that side. Now, you're not trying to kick your nose or kick the back of your head. We're just trying to get that leg moving and warm up the quad, hip flexor, hamstring, and glute, okay? All at once. Once you're done with that, we're going to get a little bit more dynamic. We're going to go into something called a skip. So we're going to get bouncing here first, and we're going to drive one knee up and get those arms pumping as well. So we're trying to get that calf working about 10 seconds, and you're going to do that 3 times. Okay, we're going to get the calf, hip flexors going again. Drive that knee up because that's what we're trying to do when we cycle. And we're feeling those feet as well, okay? From there, we're going to hold on to our bike or some sort of structure, and we're going to try to kick our butt, okay? So we're going to try to pull and mimic that cycling motion and try to pull that heel to our butt, okay? You want to do 20 of those, switch sides, and do another 20, okay? So we're really trying to warm up that tissue. The other thing that this warm-up does is kind of give you some input as to how your body is feeling that day. So very important to do your warm-up before getting on the bike.
Woo!
Okay? Now we're going to get into some, you're already feeling it.
I'm already feeling it.
Some strength work. So we're going to do some alternating lunges, okay? So making sure that we're feeling that back leg, that forward leg, quad and glute, okay? We're warming up the ankles as well. Nice push off. So it's kind of a full kind of lower body activity that you can use to gauge how you're feeling that day and get those muscles pumping. Once you're done with that, about 20 yards or so, or 20 total, you're gonna hop on your bike and do a nice, easy 10 to 15 minute ride, get your sweat going and your heart pumping, okay? Now, switching gears, you're not on the bike, you're in your training mode, and you're
Between rides, right?
Between rides,
Yeah.
right? So you're training, you're doing your strength training and all of that. We're going to show you a few exercises to work on increasing the mobility and the freedom within your lower body, as well as your neck and shoulders, okay? So we're going to start off with something I call hip cars, or controlled articular rotations. And so I'm going to have Dr. Zhao hold on to a chair, because we want to make sure that we're isolating one side. And so what we're trying to do is open up the capsule. So she's going to start with one leg up towards the ceiling. She's going to open it up. So now we're opening up that hip, and she's going to reach her heel up towards the ceiling. So we're working internal rotation. She's going to reach back and then release, okay? She's going to reverse it. Reach back, bring that knee up, rotate around into external rotation and down. Okay, you're going to do 3 of those per side. Now, as you're rotating, you want to make sure that you're not leaning or rotating the pelvis to assist. You're going to feel that deep in that hip capsule as you work your way around. Good. You're also going to switch sides. Okay, so make sure that we complete that on both sides. Then we're going to go into strengthening and getting more hip flexion. Okay, so if you have weak hip flexors, it's going to be hard for you to get that knee up and generate that power when you're cycling, especially on those hills. So we're going to start down in a half kneeling position, and I'm giving her this chair so she has something to hold on to, okay? So what she's going to do is she's going to go into a nice full lunge stretch. She's going to feel a stretch on that down leg, right? She's kind of taking inventory of what's happening at the forward hip. She's going to hold that for about 30 seconds. She's going to come back, and then we're going to get tight through our body. We're going to start to feel some tension happening in that glute that's down, abs. We're going to take this top leg, this forward leg, and she's going to get tight. She's going to lift it as high as she possibly can without rotating. She's going to hold for 4, 3, 2, 1, relax. Good. She feels that. It feels amazing. Okay, now that you can get your foot that high, let's say a yoga block in height, you're going to put your foot on a yoga block, let's say, and try to push from there. So now I'm going to give her a target. So go ahead and lift right there. So she's got to hover there, and now she's got to lift higher than that, and she's going to hold it. And this is how we increase that mobility. Good. Hold and down. Whew. So we're going to do 5 of those per side, 5-second holds. All right? Ready? We're going to move along to the knee and ankle area. So what we're going to do is you would need like a wall for this. It could be a foam roller, it could be a tree, but just some sort of target. So I'm going to have her use the table leg here, or the chair leg here. Okay, so she's going to put one foot in front. She's going to put her toe right up against that table leg. Okay? And then what she's going to do is drive that knee, keeping the heel down, to that table or chair. So she's holding that position. You should feel a little stretch. If you don't feel a stretch in the Achilles area, she doesn't feel one, she's going to back that foot up. And she's going to keep the heel down and try to take that knee forward over her toe. And she feels a stretch there. You may feel a little bit of tension in the front if you're lacking that dorsiflexion range. She's going to continue to reach back. Now she's really feeling it, right? So how long do you want to hold this? I recommend doing 5 of these 10-second holds, and make sure that you're doing both sides. Again, very important to keep the heel down so that you're increasing the elasticity in the back of the heel and calf, and opening or closing the ankle here in the front side of that shin, okay? Now, moving along to the spine. So, you get to the spine, a lot of times we spend many minutes or hours even, if you're a long distance rider, in a kind of rounded spine position. Ideally you're in a neutral spine position, but not everybody can hold and maintain that, okay? So we need to create a more resilient spine. So we're going to stand up, and we're going to cross our arms over our chest, okay? So we're going to get tight through our abs, and we're going to do something called spinal cars, or again, controlled articular rotations, and she's going to round her spine. She's going to feel like she's doing a standing crunch, okay? Then she's going to hold that position, and she's going to rotate and continue to crunch and pull her shoulders towards her hip. And then she's going to reach back with that shoulder. Now she's going into extension, and then she's going to rotate, and she's going to try to squeeze those back muscles as she rotates around. And notice nothing else is moving. Hips, pelvis, feet, they're all staying right there. And we're going to continue in that rotary direction. Okay, we're holding, we're squeezing, we're hugging ourselves, creating that tension through our abdomen and glutes, and it's harder than it looks, okay? So you're going to do 5 in each direction. So when we get here, we're going to stop and we're going to reverse. So here we go. Keep that pelvis square, facing forward, side bend, keep the chin tucked, try to really rotate through your spine, lateral flex, forward flex, and doing an extension and doing everything that the spine does, okay? So after that, what we're gonna do is we're gonna access the neck now. So you've been on the bike, your neck's getting a little tired, I have a couple tricks for that. So we're gonna do neck cars. So we can do cars just about at any joint, okay? And so we're gonna place our hands behind our back. She's gonna pull her shoulder blades together, okay? Because we're gonna make sure the shoulders stay out of the equation. So we're gonna do the same thing that we did with the spine, we're gonna do with the neck, okay? And this is good for anybody, especially if you work at a desk. So we're gonna drop that chin to our chest. So similar motion, but we're trying to really tense the muscles in the front here. Then we're gonna sweep the chin across the collarbone, over towards the shoulder. She's gonna reach back, she's squeezing all the way up into that extension. Don't close your eyes, keep your eyes open as you rotate over to the other shoulder. Then she's gonna pull forward, and notice the rate at which she's going. It's very, very controlled, because what we're trying to do is create more freedom in that cervical spine, thoracic spine, lumbar spine, whatever you're working on. We want to create more freedom there so you can build more strength and more power throughout that motion. Good, so you're gonna do 5 each direction, And we're talking about very controlled, okay? So don't fly through these. These aren't neck circles. These are controlled articular rotations. Now, you've done a few of those, you've reversed, it feels good, you maybe get some pops, clicks, that's okay as long as there's no sharp pain associated with that. And if you have a previous underlying condition, you consult your medical professional to see if this is right for you. Now, real life, we're gonna get on the bike, and a lot of times when we're on the bike, especially if we've been on it for a minute, we are tired. We don't even know if we're over gripping, right? We may be tense through our shoulders and our neck. So here's a quick and easy one that you can do. It's called the chin tuck, okay? So you're going along, you wanna make sure you relax your shoulders. Just take a body check, right? Breathe deeply, and then she's gonna take her chin and she's gonna pull it back, okay? Eyes are open, she can still peripherally see in front of her, okay? You're gonna come back up, and then pull that chin back again. Good. So while you're on the bike, you're on a straightaway, okay? You're gonna do that body check. This is not one you do when you're climbing a hill or going down a fast hill, right? You're on your straightaway, your legs are pumping, you're in a nice groove, and we're just gonna take a body check to see whether or not we can relax and focus on moving that neck while we're on the bike, okay? 10 of those, do it every so often, give yourself a nice body check, and that'll set you up for success for your long endurance rides.
Have fun and stay safe.